Welcome back to the Health Tech Edge. I'm Mike Moore. Today we're talking about a problem everyone in healthcare knows all too well: messy data. The dashboards don't agree, reports take weeks, and leaders still don't trust the numbers. It feels like a giant bag of receipts. My guest is Ryan Leurck. He's the Chief Analytics and Product Officer at Kythera Labs. Ryan started in aerospace systems engineering, where everything has to work together before the plane ever takes off, and now he applies that same mindset to healthcare data. We'll get real about why claims and other sources are so hard to use, why vendors rarely tell you what's missing, and how to fix the root issues with remastering, tokenization, and better engineering. We'll also talk about a practical shift that's happening right now using AI so people across the organization can ask clear questions and get reliable answers without waiting in the analytics queue. No hype, no product pitch, just straight talk on what's broken, what's working, and what you can do this year to make your data trustworthy. Ryan, welcome to the show.
Hi, Mike. Thank you for having me.
Thanks for being here.
Pleasure to be.
People have been in healthcare as an industry or tech as an industry all their lives. You've got this interesting background where you've come from the aerospace world and now working with data in the healthcare space. Tell us a little bit about the journey and kind of how you got where you are.
Yeah, I certainly never saw myself in healthcare, but I have enjoyed it immensely and the challenges that it provides. I was always interested in aviation as a kid growing up, planes all over the posters and the walls and everything like that. So I was good at math and science and those things. So it was natural for me. I went into aerospace engineering, wanted to design planes. And so I ended up on the faculty at Georgia Tech in the School of Aerospace Engineering. And we were working on systems design optimization methods using all the emerging machine learning models and AI as we called it back at the time, and applying those methods to advancing the state of the art and how you can design complex things.
Yeah, and the complexity of the data and all the telemetry coming off an aircraft when it's in flight, and obviously the design process of kind of getting it ready to go into the air. I'm sure that there's just an overflow of data. And you mentioned the term system of systems. So how does that relate to kind of the concepts of the data that you see in the world of healthcare?
Well, there's quite a few similarities and then some really big differences. As you mentioned, yes, there's data flowing and all kinds of complexity on aircraft and missile and radar systems, things like that. It certainly overlaps with healthcare in the sense that there's a lot of large data problems, right? The volume, the velocity, all of those, the 5 V's there of big data. But one of the big differences, I would say, which is at the source of a lot of the problems that we deal with in working with healthcare data, is the way that data is generated and collected and aggregated, right? If you're designing a system, a modeling and simulation tool or something for designing an aircraft component or something, you get to decide how the data comes out of that simulation, right? And so if it's a mess, it's your fault. But when you look at healthcare, there's all kinds of data that people are trying to use for all kinds of purposes that was not the original intent of that data, right? Claims, for example, seems to hold lots of promise for being able to mine information about who's treating whom, where, which patients have which diagnoses, where are they going for care, all of those types of questions. But you've got to remember that data was collected at over 1 million points across the United States, people typing things in when you go for a visit. So while there are some similarities, and there's a lot of similarities in the methods that we can bring towards analyzing this data, the characteristic challenges certainly are different.
Yeah, I just caught an article just before we hit record this afternoon, where it's an article about payers talking about aggressive coding by providers as the AI wars start to build, and kind of this, I think, the resources are being amassed on both sides of the line in terms of AI and the power to use it, hopefully not in an adversarial way, but that seems kind of how this article came across, right? Is that you've got ambient listening in the exam rooms, and the doctors don't have to worry about documentation, because then it's going to recommend all the coding to them afterwards when they go work on their notes based on everything it heard in the room. And now all the codes are going to come in, and the charges associated, and the insurance is going to fight against it, and all of that. So how do you think that's going to play out, or what are you doing, from the Kythera Labs kind of point of view to kind of help with those sides of the equation?
Yeah, well, one thing is to mention is that kind of, as you point out, there's lots of things going on with the data, lots of people touching it. There's a long chain of custody. And you and I and others that are trying to use that data for our own purposes inherit all of that. So I mentioned all the collection points, but as you mentioned, as that data gets passed around, everybody touches it a little bit. HIPAA and consumer protection laws and things that are meant to protect privacy has a huge influence here. That is of utmost concern, certainly to anybody that's working with this data. But what that means is that every time that data gets touched, there's layers of obfuscation that get applied, or privacy preserving features get removed from the data, things like that. And so downstream far enough, you've got quite the challenge on your hands. The coding thing is actually interesting too, because all of those dynamics are at play. When we receive a data set, or we get our hands on a data set as an analyst, you want to immediately start mining insights from it and making it suit your purpose. But that's a prime example of one of those things where the data may not be reflecting reality as you think it is, right? There is upcoding, there is fraud, there is plain old mistakes that are being made. And so, you've got to kind of look out for all of those things.
Yeah, I think that healthcare too, as an industry, and having worked in tech for more than 30 years and with a variety of industries, I've seen sometimes the data is the data and it comes from a source system and it can be mined and analyzed and interpreted. But to me, healthcare data seems even more like it lacks context, that it needs to be combined with other sources to really get the context for kind of what it means and what actions we should all take on it. I think, there are some are kind of siloed systems that can kind of tell their own story in that. But in terms of the greater mission of healthcare and improving outcomes and improving access and reducing cost and reducing waste, it seems like data needs to come together and get that context to then really be able to ask those questions that need to be asked and answered that will affect change. What's your take on that?
Yeah, absolutely. I mean, all of those things are good examples of uses that that we would love to apply this data to, but you have to remember, none of these data sets were generated for those purposes, right? So a medical claim is what it is and is designed with the elements that it has so that people can get paid. And so there's lots of intricacies of how the providers and the payers are using that data element to communicate about the necessity of care and, the reimbursement rates and making sure that things were handled according to the contract that they had worked out. Right? There might be elements in that claim that's specific to the purpose of it being billed that would maybe lead you astray. Just a quick example, the address that's listed on the claim in many situations is not exactly reflective of where the patient really was. It has more to do with, in some cases, limited circumstances, where to send the bill, or I'm sorry, where to send the payment, right? So there's, of course, all of this is spelled out in codes and things kind of very esoterically on the claim, but most of us aren't thinking we're going to have to do that level of interpretation when given a data set.
Yeah, and I think the patient experience or the health plan member, however you want to frame that individual receiving care, it gets very confusing in terms of figuring out where to go for care, right? It's like, well, your doctor is covered, but not if they're in that building, but only if they're in this building. And then it gets, billed out of another entity, right? So yeah, there's a lot of confusion just built into this. So I know you use a term called bag of receipts to kind of describe the mess that is healthcare data. Do you want to unpack that a little bit and explain what you mean by bag of receipts?
Well, sure. Yeah. I mean, it actually goes back to the topic we were just addressing. I mean, these claims, I'm saying claims a lot. It's only one type of many types of healthcare data that tend to get used for analytics purposes. But a claim, right? If you think about buying these claim sets, there's 20 billion records in some of these sets, depending on where you're going to get your hands on it. 20, 30 billion in the final combined data set. And it's the best analogy I can come up with. It is a giant bag of receipts, right? And your task is to try to interpret from just looking at receipts what is really going on in a market, so that you can use that to make data-driven decisions in your business as a provider or as a life sciences company. And so, I always have the mental image, right, of the FBI in the Thriller movie or something. They grab the garbage bag and all the fragments and they lay it out on the table and try to piece together what was going on. That's what it feels like a lot when trying to make use of this stuff and
Yeah,
integrate it.
it's the bag of receipts after it's been put through the shredder, right? Good luck trying to understand it. Yeah.
Exactly.
So, there are obviously a lot of data vendors that are out there who are willing to provide services to help healthcare organizations
Mhm.
take their bag of receipts, put the pieces back together, structure the data, make it available for analysis, all of those things. What's your take on kind of the state of the market and the data vendors and, what they're doing to help or not help in terms of what customers are trying to do?
Well, we've been in this space, my other co-founders and myself, for 15. So, some of us, if depending on which subset you're looking at, go back 25 plus years working with these data systems and things. And, the industry is one that people don't often think about. It surprises certain people to know that, yes, those data are available on the market for purchase and analysis. I would put everybody at ease here, just as an aside. I mean, these things are very rigorously de-identified. They're not selling anything with personally identifiable information or anything like that. They sell them stripped down so that we can kind of look for patterns. Um, but this is data that's exhaust from other processes, right? So we mentioned billing for claims. Well, there's similar data sets for electronic health records, which are the systems that the physicians use in the practice of care, right? So it's the purpose of that is not for them to get paid, but it's so that they have the information right in front of them that they need when they're speaking to the patient face to face, and they have an ability to record additional information that's relevant to their treatment. And so these data sets have been out there for a really long time. And it's probably only within the last 10 to 15 years where the technology is advanced to a level where you have the ability to realistically deal with all of it, right? With a lot of the big data computing technologies, Spark, like Databricks, for example, really kind of becoming very mainstream and giving people the ability to work effectively with this. But the data sets themselves, I would say, have changed very little. There's not an awful lot of movement from the data vendors to kind of make a more refined product. And we've worked with all of them. There's a lot of big players. Remember, this is a secondary business for them. So they're conducting say they're a clearinghouse. They're routing the claims between the providers and the payers. It's an ancillary source of income for them to do that. So there hasn't been a lot of motion, and it is extremely difficult for someone that, like, let's say you're an analyst at a healthcare provider. You may have a lot of experience in the healthcare industry. Maybe you came up as part of the administrative side, or you're a clinician yourself, and you find yourself in a role where you're trying to make use of these data sets. There's not an awful lot of help coming from the vendors in terms of understanding all the biases we've talked about so far, or just as important, understanding what is not in the data, right? Because none of the vendors have all of it. And so if you buy a national claims database, well, there's going to be things missing. And if you're looking to do things like understand your market share or understand the full panel of treatment for a physician, things that are missing are a big problem.
So we've got a messy data environment. We've got just within the healthcare organization, we've got kind of some stagnation in the data vendors and the products that they're supplying and the data sets they're supplying. And now you've got this big wave of AI innovation that's hitting every industry, including healthcare. Sounds like the conditions are ripe for some disruption and for some new things to happen. So, what are you seeing now as some
Absolutely.
new opportunities as you look at the market and what's happened over the last couple of years here?
Yeah, well, there's several big things that are all coming together. One I kind of mentioned already is the availability of these large data analytic systems in the cloud, Databricks, Snowflake. Go back a few years, people were rolling their own with Hadoop and those types of technologies. But you have tech available that can even make this a possibility for someone to consider. But B, what that also does is it enables companies like my company to say, listen, this is a hard problem, and it's going to be really hard for the thousands of providers across the country to staff full teams of people that have the requisite experience to do these types of analyses quickly. And so there's the opportunity to package that intellectual property or that subject matter expertise as code libraries that can execute within their system, right? So that you can kind of help speed them up. So that the technology infrastructure, I would say, is a major enabler. Even that, if you think of that as kind of the first wave, that's still maturing, right? And as you know, every industry follows different paths in terms of their speed to adoption of new things. Healthcare, while you do have a lot of really innovative companies kind of on the leading edge, I would say the majority are a little bit slower to adopt big changes in their technology infrastructure. They've got big important operations, right? So risk is a big concern to them. But then kind of as you were leading there too, I mean, AI is one of those things that is making certain types of analyses or data management processes something that's a little bit more efficient, easier to do. And I would highlight the making it more accessible to maybe a lower technical skilled user. Maybe they don't know how to write SQL or they don't know how to get in there and code big data pipelines. There's a lot of applications that AI can assist with for helping folks make use of the really tight budgets that everybody in this industry is experiencing.
Yeah, I think for a long time, the analytics team within a healthcare organization, whether that's payer or provider, they had job security like you wouldn't believe, right? Because there was always a backlog of data requests and reports that people wanted to see from them. And, there was more work than there was time in the day to create all of those reports. I think now
Yep.
with the wave of innovation that's hit and, the accessibility point that you just made there at the end about what it takes to get access to the data, the AI tools and the innovation that comes with AI, I think changes the game. I don't think those people are going to lose their jobs. I think they're going to work on higher value data work for the organization. But in terms of putting the tools in front of someone so that you can interrogate the data because now it's been put together and structured in a more collaborative way, right? Whether that's a chat interface or something else like that. I think that's some of the stuff that you're indicating, right? It's like the barrier to entry. I don't have to write SQL. I could sit in front of it. I still need to know what questions to ask, but as long as the data's been prepared, then I can access it and ask those kind of questions that are going to help me improve care outcomes, identify risks, identify opportunities, reduce operational costs, whatever those scenarios might be. Am I following kind of where you're going there?
Yeah, I would agree almost entirely with you there. The folks, as you mentioned, the analyst teams within providers and life sciences companies, they're definitely not going to be going anywhere because I would say they're underfunded and understaffed generally in the first place, right? You did mention bottlenecking and things like that. There's, everybody has a desire to make data-driven decisions and have as much information as they can possibly have. And so, yeah, there is often a kind of a long pole in the tent, right, of having somebody that can get into that data, get the answer, build a report, get it back to you. And so, yeah, you'll see these things queuing up, et cetera. So I don't think that the size of the workforce that's employed against those types of activities will decrease. I just think you're going to see people be much more effective, right? Their job description might change a tiny bit because, as you said, the staging and the cleansing and preparation of that data is paramount, certainly for anything that you want to turn an AI agent loose within, because it's going to take it for granted, right? That data, it's not going to know what is accurate and what is not, and so there's a lot of care to be put into the source that your AI agent's going to be sitting on top of.
There's still always for everything AI related, the expression "human in the loop" is consistent, right? That someone needs to look at it and evaluate it, and right to understand, is this complete? Are we missing something? What is the context, right? And kind of, there's always that human. The human analysts, though, will probably take themselves and retitle themselves as data scientists and then double their salaries, or put AI, data analyst into their title and, triple their salaries. So good for them, that they deserve it. Let's talk maybe about some customer examples. As we record this, we're towards the end of 2025. When you think back to some of the impactful projects that you and the team worked on this year to help healthcare organizations, without naming anyone, we'll kind of protect the innocent there. Like, are there any stories that jump out at you, some of the projects that you and the team worked on they're particularly proud of, where you were able to generate some great results and kind of driving some of this innovation and helping to clean up this messy data?
Yeah, I'll introduce my answer to that by mentioning another aspect of the challenge that folks are facing, and that is we've talked a lot about third-party data sets, but providers have data already. Like we said before, this data is coming out of provider systems ultimately. So they possess information about patients that they've seen, the procedures that have happened within their four walls, et cetera. And one of the big drives is to get a better understanding of what's happening outside of their four walls, which is the motivation for incorporating some of these external data sets in the first place. We mentioned the de-identification at the beginning of how This data has to be identified. One of the advantages of doing that, apart from maintaining privacy of the patient and all of that, is that you then have the ability to link data sets that link them together by patient dimension. If you can convert all of the patients to the same identifier, then you can stitch those data sets together. There's a lot of problems that go in with that, as you can imagine. When you run the de-identification software, there's a lot of false negatives, false positive matches. Things go wrong in that process too. But let's say you can solve that, then you can stitch your data together with that external data and really get a good picture of exactly what's going on in your market. That gives people the opportunity to cover over some of the challenges of missing data in these data sets. And so really just kind of build their own unique local picture. And so that's one of the big focuses that we had over this past year, was converting some of the technology that we had built when we were doing the analysis on behalf of our customers, converting that into something that can run inside their own environment, behind their firewalls, and has the ability to merge their data and right alongside with these other sources that they're purchasing. So we worked with one regional system in particular, stands out for me because it was our first one that we did with this type of an architecture. It was a little bit over a year ago now, coming up on just about a year. And so we were able to deploy the data pipeline code into their environment. And I think it was like around December 10th is when the contract was signed. And before the new year, we were briefing their CEO on, I'll use some industry terms, their leakage and keepage metrics, which are really important to providers. That's a description of how well they're doing at keeping the patients inside their network. They found that those metrics were almost, I think, 60% different than what they thought
Wow.
they were, and led to some pretty immediate changes in strategic approach coming into the new year. So that was really satisfying to kind of get to see that work with the launch customer, and we've done a whole bunch of them since then.
Yeah, that's exciting. And I think that kind of percentage, and obviously numbers are relative, but percentages I think we can all relate to in saying, like, if somebody found that something they thought as a metric was 60% off of where they thought it was, that's some eye-opening stuff. And there is a lot of planning that goes into each year and how they're pricing and how they're competitive in the market. I mean, I was looking at a vendor's website yesterday, one of the price transparency vendors, where you can look up what any given procedure costs in your market. And I just as a 52-year-old guy, I saw colonoscopy was one of the top choices, and something my doctor's been recommending and I've been avoiding for now, but should probably do. And just looking at kind of here in the metro Boston area, the price range for that one procedure, if you were a cash payer, was really eye-opening to me. And I know that these data sources are available and we should be looking at that as consumers, but I'm sure you can relate as well. It's one of those things that we just take it for granted, and it's not until something comes up that we would have to. Most of the time we just go with the doctors we're using, the system we're plugged into and all that stuff, versus shopping around. Like if we were going to buy a car, we would shop around, but for something like a colonoscopy, I never see a bill for it anyway, right? My health plan is going to cover it, and I just kind of just easily go in, make the appointment, don't even think about it.
Yeah, it's funny, that transparency data is kind of an interesting animal. The genesis of that data set was regulations that were passed, right? To say Transparency in Care Act of, I think I probably butchered the name there, but it was signed a few years ago, and the goal, right, was so that the consumer would be able to do just as
Yep.
you say. Kind of go in there, what is the pricing, for this procedure in this market. But you can imagine, this is my own personal take, having looked at the data and tried to figure out how to use it. You can imagine that the payers and the providers, there's at least a few people that probably aren't super excited about having to publish their rates publicly. And, while everybody did comply, it seems, when you get into the data and you look at the structure of it, that they complied in probably the least convenient way possible. So there's tons of duplication in it. That it seems the data model is made intentionally far too large for anyone to realistically, like any individual working from home, to realistically make use of. So we do incorporate that data into a few of the pipelines that we've got, because a lot of the use cases for provider are interested in understanding their rates and their competitiveness. But that data set in particular is somewhat amusing to me.
Yeah. I think the question you look at, especially with some of the huge swings, and just like, again, I said, I looked at the one procedure, where it's double the price, somewhere else. And you think, are we really comparing apples to apples here? Or is there something different about what service is being provided or what's being included in the number. So part of the mystery. So as we sit here, and again, I said we're kind of late 2025. If I'm thinking about 2026 and what is to come and kind of what's available technology and what's to come, what advice or recommendations do you have for healthcare leaders?
Yeah, I think people are becoming a little bit weary. They've been in the market for a long time trying to make use of this data, and there's an awful lot of contract hopping, right? They go from vendor to vendor, and I would say that just give the words of encouragement that I think that we're finally coming out the other end of the tunnel with the ability to make use of this stuff at scale to actually start getting really good numbers out of it. I think people are a little bit gun shy because they've purchased data, they've done all the work, they've staffed the large teams, and just struggled to get the value that they had hoped out of it. But yeah, I think that we're at a confluence of lots of things technologically in the market that is going to make these things, really start popping.
I think it's working with strong partners, obviously, that can help them bring that data and generate the kind of insights that they're looking for.
I think we're going to see those completely change over the course of the next 12 to 18 months, for example. BI as we know it is going to feel a lot different. It's going to be a lot more natural language input. Basically, like if you had an assistant right next to you that was going to go in and munch through the data and get your answers. I think that's one thing people should expect.
People who use AI tools every day, who are using ChatGPT as kind of a coworker, right? That's, like you've got an expert in everything sitting right there to able to help you. Now, what if that expert was just zeroed in on the data sets that you need for your job? It's not the world's information, right? Because we need to have that specific expertise in this data set in our business, the confidential things that we want to be able to ask it, and being able to have that as kind of a trusted coworker that you can go to, and they are infinitely patient. They're going to sit and answer all your questions all day, every day, to be able to help you get the answers you need to make decisions for the business. And I think what everybody needs in terms of equipping themselves to go make the right kind of decisions for their organization.
You can't just put your data up on ChatGPT, right? You don't want to pull a Samsung. I forget how long ago that was. There was the group that accidentally uploaded all of the technical documents to ChatGPT, and oops, now they're gone. So it's kind of waiting on that technology to be able to be something that you can host, that can operate only within the bounds of the data system that you've got. Nothing's leaving your four walls. That's been a little bit longer road. I'm waiting for that architecture to catch up, but yeah, we're certainly playing in that space. Many others are, and it's exciting to see.
That's great. Well, thank you for sharing all your great insights with us today, giving us hope to get out of that messy data, that bag of receipts, bring some structure and order to things, be able to answer questions that have been sitting in a queue for a while, and start to really drive some of the insights that so many organizations need to more efficiently run their operation, be competitive in their markets, and ultimately deliver better, more cost-efficient care to the patients that we all love and care for. So thank you for your insights today, Ryan.
Absolutely. It was a pleasure. Thank you,
All
Mike.
right. Well, that's it for this episode of the Health Tech Edge. We thank everybody for joining us. If you enjoyed today's episodes, please like, comment, share with a colleague, and subscribe for future episodes. With that, I'll go ahead and sign off. It's Mike Moore with the Health Tech Edge. Thanks for joining.